Good morning and welcome. I'm just going to give it one more minute to let folks get logged on and settled in. We're glad you're here for our briefing on Pulse. Dave, you could go ahead and start sharing your screen whenever you feel ready. All right, we're going to go ahead and get started. Welcome, everyone. My name is Jace Woodrum. I'm a senior officer at the Colorado Health Foundation. I am so glad you are here. This conversation is focused on Pulse, the Colorado Health Foundation poll, and we're going to be talking about what we heard when we asked Coloradans to talk to us about the cost of living and housing. It's like my birthday today. I mean, I have the honor of leading public opinion research at the Colorado Health Foundation, and so this is a day I look forward to. I've been staring at data, at charts, and at graphs, and now I'm excited to make other people stare at data and charts and graphs along with me. So I'm really, truly happy that you are here. I'm going to start us off with just a few housekeeping notes, and then we'll dig into the data and get to a conversation at the end. So Dave, you can go ahead and go to the next slide. For today's briefing, as you probably know, you are muted and your camera is off. We do still want to hear from you though, so please use the chat. We invite you to share your comments, your questions, your thoughts, your insights. We've got a lot of folks who are monitoring the chat, so if you do ask a question, keep an eye on the chat for the answer. Some questions we may answer verbally after the presentation. So please, let's use that chat to have conversations with each other over the course of the next hour. Closed captioning is available. You should see in your Zoom toolbar the option for closed captioning, and you just select that caret and go to show subtitle. We are recording the conversation today. We will make this recording available. The slides are already available. Check the chat for a link if you want to follow along with the slides that we're going to be talking you through today. And if there are any other housekeeping announcements, my wonderful colleagues who are monitoring the chat will make sure that they are there in the chat in case I've forgotten anything. You can go ahead to the next slide, Dave. Just a quick reminder of who we are at the Colorado Health Foundation. We exist to bring health and reach for all Coloradans, and we really focus on people living on low income and people of color. We want everyone to be able to say, I have everything I need to live a healthy life. And our North Star is equity and health equity. So we charge at this goal through grant making, through policy advocacy, and through research, which is where I live at the Colorado Health Foundation and what we'll be focused on today. Next slide, Dave. You know, a lot of people ask me, why would a health foundation conduct a poll? Most people often think about polls as a way to predict the winner of an election. That's not what we do with our annual poll. It's really about taking the pulse of Coloradans across a range of issues that impact our health and our well-being. We really think of it as a way of listening, of hearing from people outside of our bubble. I don't know about you, but I mostly just talk to people who agree with me, who think that I'm smart and funny and handsome. And I don't often talk to people who might disagree with me or might have different values or a different way of looking at the world. And Pulse really pushes us to get out of our circles and to talk to people who may have different experiences, different worries, different priorities than us. And it really gives us a chance to gain a deeper and a greater understanding of how Coloradans are navigating today's unique challenges. I mentioned earlier that at the Colorado Health Foundation, we prioritize people living on low income and people of color. We know that income and race are two of the biggest barriers to having good health, and we want to tear down those barriers in our work. In every part of our work, we look at how can we center race and how can we drive toward equity. And in Pulse, we do that through our oversamples. So we oversample African Americans, Asian Americans, and Native Americans. And what I mean by oversample, that's geek speak for we're talking to more than the population. So if African Americans are 4% of our population in Colorado, they're going to make up more than 4% of our sample, so that we have increased confidence in the numbers. We have more than 100 respondents in each of these racial and ethnic groups. And if you're thinking, what about Latinos or Hispanics? They make up more than 20% of our population. So we always have a really strong sample of Latinos and Hispanics. We always feel really confident in the data there. So we are prioritizing these smaller communities of color that are often very difficult to engage in research, and we often don't have good data about these populations. So I'm really happy that we're able to devote the energy and the resource to have these oversamples. And I also have need to express some gratitude toward our partners who help us achieve our oversample of Native Americans. I've listed them here for you. They've been incredible partners both this year and last year at helping us achieve an oversample of Native Americans, which is something that rarely happens in a statewide poll like this one. So that's why we do Pulse, how we see it as mission aligned for us. And now I don't want to stand in the way of what you came for, the juicy data about what Coloradans told us when we asked them about their experiences, their concerns, and their priorities. I'm going to turn it over to two members of our research team. They've been working with us now for 3 years. They are incredibly smart and insightful. They're a bipartisan team. We have a Democratic pollster and a Republican pollster, and they keep us honest and unbiased all the way through our process. So we're really, really lucky to have them. It's Dave Metz and Lori Weigel. I believe Dave is kicking us off to begin. So Dave, take us away.
All right, fantastic. Thank you very much, Jace. Thanks to Colorado Health Foundation for the opportunity to participate in this poll, which every year just gets us, I think, fascinating and very helpful results to understanding where Coloradans are on major issues of the day. So I'm Dave Metz. I'm a partner with FM3 Research, and I am the Democratic half of the polling team. I'm going to start out by walking through some of the key findings in the data that speak to major issues that are on Coloradans' minds related to the cost of living. And then we'll hand it over to my colleague, Lori Weigel, to take a deeper dive on one of the things that is sort of the most urgent cost of living concern for Coloradans in this year's poll, the cost of housing. But first, a little bit about the overall methodology of the survey. We spoke this year with nearly 3,000 Coloradans, coming from a range of different backgrounds in different parts of the state, selected at random. As Jace noted, we oversampled certain populations within the state that we wouldn't be able to speak to their opinions with a great deal of statistical confidence without getting those extra interviews. And to make sure that we had the most diverse and representative sample of Coloradans, we conducted the interviews by telephone on both landline and wireless phones, and also had an online survey component to which participants were invited to join by both email and text message invitations. In addition, we conducted interviews in both English and Spanish, again, to make sure that language barriers among Spanish speakers were not an obstacle to participation in the poll. In all respects, the methodology of the survey is very consistent with the 2 prior surveys we've conducted in 2021 and 2020. And I think one of the most interesting things about this year's data is we're able to see how public opinion in the state has evolved over the course of those 3 polls. And there have been some real dramatic differences. Obviously, it's been kind of a tumultuous 3 years. And we see that reflected in the way that Coloradans' concerns have evolved over even that short period of time. There are a number of places where we will draw some geographic distinctions within the state. We divided the state into 6 regions by county, as you see here. We have the Denver metro area, El Paso and Pueblo counties we treated separately, and because we oversampled Pueblo County, even though it's a relatively smaller population center, we have enough interviews there to speak meaningfully about some of those differences. We look at Larimer and Weld counties as distinct from the balance of the state, and then we have the Eastern Plains and the Western Slope. So you'll see these geographic divisions with a number of data points that we're reviewing in the poll. So to start with, big picture, one of the first questions we asked in this year's poll, as it is every year, is for people to tell us in their own words what they see as the most important issue facing Colorado right now. So this is an open-ended question. People can tell us anything that's on their minds, and we then group and categorize the responses as you'll see here. And this was the first in a number of indications in the poll of the degree to which cost of living concerns are really central for Coloradans. 20%, plurality of those polled, mention cost of living concerns as what they see as the biggest issue facing the state. Just behind that is affordable housing, which obviously itself is related to the cost of living. Given that these are the two top concerns that Coloradans speak about, those are the two subjects we're talking about today and in our initial briefing. You'll see a range of other issues that people mentioned relating to the environment, political divisions in the state, overdevelopment or overpopulation of the state, but it's really cost of living concerns that were at the top of the list. And to give you a flavor for how people responded to this question, you'll see some examples of what the respondents told us in their own words were the major issues facing the state here. And a number of them, as you'll see in the examples on this slide, do relate to issues relating to the cost of living. Now, because this is an election year, and when we do this poll in an election year, even though we aren't asking, as Jay said, about horse races and who's ahead in different contests, we do want to understand what issues are on Coloradans' minds as they're heading to the ballot. So for the subsample of our respondents who indicated that they are registered voters, we asked them to tell us what issues will be most important to them in deciding which candidates to vote for in November. Slightly different context than that initial question, where we're just asking about what they see as the most important issue facing the state. But once again, you'll see a lot of these same concerns rising up pretty close to the top. Cost of living, inflation, affordable housing, and rent are mentioned by about a quarter of those polled as being the issues that will be front and center for them when choosing a candidate in November. And again, you can see some examples of the things that people told us in their own words would be what was on their mind when they're picking candidates. So these questions really give us a sense of what's at the top of Coloradans' minds, what they think of without any prompting when we just ask them to tell us both what their concerns are and what will be guiding their votes come November. And the cost of living, in particular the cost of housing, are front and center. We saw further evidence for the dominance of these concerns in a later question in the poll, where instead of asking people to volunteer what's on their mind as a problem, we read them a list of concerns facing Colorado and had them rate each one as either an extremely, very, somewhat, or not too serious a problem. The dark green bars on the left show you the proportion that rated each of these issues an extremely serious problem. That reflects a real significant degree of urgency. When people rate something extremely serious, that's a siren going off and saying this is something they see as a real crisis that needs to be addressed. And the two issues at the top of the list, with more than 3 in 5 Coloradans rating them extremely serious, are the rising cost of living and the cost of housing. And those are the two subjects we're focused on in today's briefing. It should not be ignored, though, that there are other aspects of the cost of living that are significant concerns for Coloradans. The cost of healthcare is rated an extremely serious problem by almost 2 in 5 of those polled, and at least a very serious problem by 2/3. And the cost of childcare. Half of Coloradans tell us that that's a very serious problem, although there's 20% who say they don't know enough to offer an opinion. Obviously, those perhaps without children or grandchildren who haven't had to confront childcare costs. So cost of living globally is a big concern, and cost of housing is a major driver, but there are other factors that are clearly on the public's mind as well when they think about the cost of living. These issues are among those where we have seen the most dramatic shifts in Coloradans' opinions over the course of the 3 years that we've been doing the poll. On this slide, you'll see the proportion that rated each of these issues an extremely or very serious problem in each year's poll. And we didn't start asking about childcare or healthcare until 2021. So those numbers, we only have 2 data points. But what's really striking here is the dramatic increase in concern about the cost of living over just the last year. 73% rated it a very serious problem in 2021. That's up to 88% in this year's poll. And if we look at it over a 3-year arc, concern has increased 26 points in just that 2-year period. The cost of housing, as you'll see second from the bottom on this list, we saw a huge jump in last year's poll from 67% up to 82%. That gained another 4 points this year. So again, over that 2-year period, a net 19-point increase in the proportion of Coloradans rating it a very serious problem. The level of concern about many of these cost of living issues is also remarkably uniform across a variety of subgroups of Colorado's population. As you'll see here, when we ask about people's concern about the rising cost of living, the cost of housing, healthcare, childcare, and if you compare the numbers across racial and ethnic groups, while there are some differences here from one issue to another, they are not dramatic. And the differences between white Coloradans and Coloradans of color are pretty modest. These are top-ranking concerns across racial and ethnic groups. And strikingly, they are also top concerns across income subgroups. Even those Coloradans who have six-figure household incomes, we've got more than 4 in 5 that rate the rising cost of living as a very serious problem, and the same is true for the cost of housing. Now, as we'll see in a few minutes, those more affluent Coloradans are not as affected by the rising cost of living. They aren't having to make as many changes in their lifestyle, but they are equally likely to recognize it as a problem. There is more intense concern, not surprisingly, around the cost of living among those lowest income households, those with incomes under $30,000 per year. So delving into the cost of living in a little more detail, we anticipated this would be a major concern, and so we had some more specific follow-up questions on the topic. We asked people when they hear that term, the cost of living, what they think of, which specific expenses are most concerning for them and people in their household. Again, this was an open-ended question, so people could tell us whatever was on their minds. And housing costs are the #1 thing that occupy them, with almost half of respondents indicating they see that as a major element of the cost of living. That's followed by food and groceries, and we'll talk in just a minute about the impact that the cost of food has had on the lifestyles of Coloradans, and then costs for fuel as well. About a third mention that. So those are the major categories: housing, food, and fuel, although there certainly are a range of other things that people see as contributing as well. The net impact of this concern about the cost of living has been that Coloradans, for the first time, we see a clear plurality who believe that they have become financially worse off over the course of the past 12 months. In both our 2020 and 2021 polls, when we asked people whether they were better off, worse off, or about the same financially over the course of the prior 12 months, you'll see we had about half of Coloradans each year that said, they're in about the same place, and then roughly equal numbers that said they were better off and worse off. Now, this was despite both of these polls taking place during the pandemic, a time of great economic uncertainty. What we generally saw was that more affluent Coloradans felt like they were better off. Lower income Coloradans felt like they were worse off. Most felt their situation was unchanged. Big difference this year. We now have 43% of Coloradans who say they are worse off financially than they were 12 months ago. Still only about a quarter who see themselves as better off. So people clearly seeing a negative financial impact on themselves. And as I mentioned a few minutes ago, with food and grocery costs being one of their top concerns, it has affected both their ability to afford food and in some cases their ability to eat as many meals as they need to eat. 38% of Coloradans in this year's poll told us that they're worried they might not be able to always afford enough food to feed themselves and their family. That is up 15 points from what we saw in 2021. So a pretty dramatic increase there. And concern about being able to afford food, not surprisingly, is concentrated among lower income households. In fact, there is a clear correlation here. 69% of Coloradans, more than 2/3 of those with household incomes under $30,000 per year, are currently worried about being able to afford enough food for their family. Only 16% of those at the higher end of the income scale. It is also noteworthy that majorities of Latino Coloradans and those who identify as Native American or Indigenous indicate that they are worried about being able to afford food. There was some geographic variation and concern about being able to afford food as well. The thing that was most striking here was in Pueblo County. We had an outright majority of 52% of Pueblo County residents who expressed this worry. And again, we oversampled that county this year, so we can speak with more confidence about what people there see. And the worry about food costs is definitely prevalent. Now, this has very specific impacts. It's not just a concern for Coloradans, but for many, it means they have actually skipped meals because they weren't able to afford food. 16%, nearly 1 in 5 Coloradans, say the cost concerns led them to skip a meal in the past 12 months. That is nearly doubled from where it was when we first asked the question last year, and only 9% reported being in that circumstance. Again, as you'll see on the right-hand side, it is disproportionately those in households with incomes under $30,000 per year that have found themselves in this position, although even many middle-income households also report having skipped meals. Also noteworthy that among Native American and Indigenous Coloradans, almost 2 in 5 say that they have skipped meals as well. So with this broad concern about the cost of living, what is it that we potentially can do about it? What might some of the policy solutions be? We offered the respondents a list of different ways, sort of broad concepts of how these cost of living concerns might be addressed, and then asked them to indicate how effective they thought each of these policy solutions might be. We had solid majorities of Coloradans who rated each of the 4 options we presented to them as at least a somewhat effective approach, but the broadest perception of effectiveness, and by far the strongest perception of effectiveness, was for the first item that you'll see on the slide here: changing government regulations to reduce the cost of household expenses like food, healthcare, and utilities. Almost 3/4 rate that as an effective approach, and more than 2 in 5 as a very effective one. And again, we've got about 3 in 5 who say the same for raising taxes on higher income households to provide more services, requiring employers to increase pay and benefits for low and middle income workers, and increasing government investment in stimulating the economy. Now, of course, when we talk about policy interventions into the economy and cost of living, there are going to be some partisan differences in the way that people react to it. Among those registered voters who are registered as Democrats, Independents, or Republicans, you'll see the numbers here. Pretty broad bipartisan support for the idea of changing regulations to address these cost of living concerns, but then huge partisan gaps on the other 3 options we presented, which dealt either with increasing taxes, adding some requirements for employers to increase pay, or increasing government spending and investment. In each case, we have the overwhelming majority of Democrats, majorities of independents indicating support, but less than half of Republicans in favor of those options. The differences across racial and ethnic groups were pretty modest, as you'll see here. For each of the proposals we tested, we had majorities of Coloradans within each racial and ethnic subgroup indicating that they viewed them as effective approaches to addressing these issues. And then finally, when we segment the results by our geographic regions within the state, there are a couple of places where you'll see some notable differences. In particular, when we talk about the idea of raising taxes on high-earning households, it is most popular in the Denver metro area, where almost 2/3 of voters view it as an effective solution. But on the Eastern Plains, fewer than half of those polled indicate that they see it as an effective solution to these cost of living concerns. So that gives you a sense of where the public is on cost of living concerns broadly. As we saw, by far the standout concern for them is the cost of housing. I'm going to hand it over to Lori now to talk a little bit more about what we learned in that area.
Great, thanks, Dave. So I'm sure that all of you have witnessed the backyard barbecue conversations about the cost of housing and what the closest house on the block may have gone for at some astronomical rate. I've been witness to that as well here in the Denver metro area, and we see this in our data quite clearly. So 86% are telling us that the cost of housing is an extremely or very serious problem. Almost no one is dismissing this out of hand. You can see a mere 3% say it's not too serious a problem. So really, this is a statewide concern. And on a related issue, when we asked about homelessness on the next slide, you can see that 7 in 10 Coloradans are telling us this is an extremely or very serious problem, with almost 2 in 5 rating it as an extremely serious problem. On the next slide, you can see that we also saw that there's been a real shift. So over the last several surveys, we have asked respondents to tell us how worried they are that they might lose their home because they can't afford their monthly rent, or mortgage. And we had about 1 in 5 for the past 2 years telling us that that was something that they were at least somewhat worried about. But that, like some of the other numbers we've talked about, has jumped up in this last survey. So 30% now, almost a 10-point increase, are telling us that they are very or somewhat worried about this. Some of the subgroups that really stand out on the next slide, not shockingly, those who are not employed at this time, those who are unemployed, are telling us that they are very worried about this. So it's almost double the rate overall in the state. So 58% telling us that they're concerned. There's also higher levels of concern among Native American or Indigenous respondents, as well as Hispanic and Latino respondents. So those are significant levels of concern among those subgroups. We also saw on the next slide that, again, as we talked about with the cost of living overall, that there is greater concern among those lower income households about losing their home because they can't afford the monthly rent or mortgage. It's a 2 in 5 or greater, even among subgroups such as those making $50,000 to $75,000, and jumps up to nearly 3 in 5 among those in the lowest income profile. But I will note, even among those in our highest income group, we have 15% saying that they're worried about this. So this is really stretching across a number of different economic and socioeconomic income groups. So what does that mean? It really tells us a lot that people are trying to cope in a number of different ways. So in order to pay their rent or their mortgage in the last year, we asked them, hey, have you done any of the following? And we're showing you the proportion that said, yes, indeed, they've had to use these different coping strategies in order to afford rent or their mortgage. So we have about 1 in 3 that are telling us that they've worked multiple jobs or worked more hours than they wanted to. Another 1 in 3 that have avoided asking their landlord to address specific problems. Obviously, that one asked among renters. And then, as we talked about with the food insecurity, we've got about 3 in 10 that are telling us they've cut back on or gone without other needs like food or healthcare in order to afford housing. About 1 in 4 as well telling us they stayed in housing that wasn't quite right for them because they felt like they couldn't afford a new place. Or again, more than 1 in 5 that are telling us they've lived with a roommate or in a friend or family member's home when they would rather not have, simply due to the cost of housing and being able to afford housing. So lots and lots of Coloradans having to undergo some different strategies in order to be able to afford the housing that they have. Not shockingly, on the next slide, you can see that this is significantly higher among renters who are undertaking a number of these different strategies. So for example, staying in housing that wasn't right for them, significantly more. A majority of renters telling us that that has been their situation in order to be able to afford housing. Almost half telling us they've worked multiple jobs for more than they wanted to, twice as high as among homeowners. And then again, double the amount telling us they've cut back or gone without other needs like food or healthcare among renters than among homeowners. So time and again, we're seeing that those who are in the rental market are really the ones having to undertake a number of different strategies in order to be able to afford this. In similar fashion, on the next slide, you can see that there's also, this is far more likely to be experiences that are more frequent among lower income Coloradans. So in fact, a majority telling us that they've cut back on or gone without other needs like food or healthcare in order to be able to afford housing, but significantly higher for all of these lower income households than we see among those at the other end of the economic spectrum. And then finally, we also see that there are some distinctions based on race and ethnicity. For example, our Native American and Indigenous populations are really reporting high levels of having to undertake some of these coping strategies in order to be able to afford housing. So what can we do about this? Well, I think any one of the different strategies that we tested here could be a survey unto itself. So we didn't have the ability to really look at all the ins and outs of each of these policies. But really, this gives us some guidance in terms of what Coloradans are telling us they think would be more effective than not in terms of addressing some of these complicated housing developments in our markets here. So for one thing, we saw that 3/4 are telling us that ensuring landlords can't raise rents on current tenants too quickly would be very or somewhat effective, especially in light of what we heard from renters out there, with 2 in 5 telling us that that would be very effective. Requiring developers to build housing for people with lower income levels. We have 7 in 10 thinking that would be at least somewhat effective, and a majority as well saying that reducing government regulations to speed up the building of new housing would be something that they believe would be effective in addressing this housing situation that we have in the state now. So there's a number of distinctions underlying each of these numbers. As you can see on the next slide, as on most issues, we see some partisan distinctions. However, the least partisan response was to reducing government regulations to speed up the building of new housing. We saw nearly the same response among Democrats, independents, and Republicans, whereas we saw more than double-digit differences on the other two ways of potentially addressing this issue. As well, we saw fewer distinctions, though, when it comes to some of the racial and ethnic distinctions here. We saw broadly that whites and people of color were all directionally saying that these are things that they think would be at least somewhat effective in terms of addressing the housing issues. And then on the next slide, when we looked at homeowners versus renters seem to be a little more enthusiastic on a number of these, especially ensuring landlords can't raise rents on current tenants too quickly. I'm sure that's a somewhat predictable response. And then on the next slide, you can see as well that there were some slight regional distinctions, but broadly, we saw some of the same level of believing that each of these would be effective. We saw somewhat higher response for reducing government regulations to speed up the building of new housing in the Eastern Plains and Pueblo and Western Slope than we did in some of the more basically along the rest of the Front Range. But really directionally, I think we're seeing a great deal of consistency in terms of all of Coloradans saying that these would be at least somewhat effective in helping to address making housing more affordable. So that was a lot of numbers. I know we have questions out there. I'll turn it over to Jace to sum up and tell you a little bit about what's next.
Thank you, Lori. Thank you, Dave. Thank you, everyone, for your questions. Keep them coming in. We wanted to make sure we had ample time to discuss this with all of you. So thank you to those who have questions. We've gotten questions about next steps, about solutions, but I'm going to start with the ones that are specific to the data. So we'll get those answered outright. So let's talk about people feeling worse off. So we saw that there was a plurality now for the first time in the 3 years we've done the poll, that a plurality are saying, I'm feeling worse off financially. Can we unpack that a little bit as we look kind of across questions? Let's dig deep. What is underneath that? What's driving people saying they're feeling worse off financially?
I think a lot of what we talked about in the data here sort of shows some of the factors that are in play. In the early part of the pandemic, we had this dynamic where a quarter of Coloradans felt like they were better off, and they were disproportionately the most affluent Coloradans. And in objective terms, they probably were. If you had savings, if you had investments in the stock market, it went up over the course of those 2 years, and you were probably wealthier at the end of it than when you started. On the other end of the spectrum, Coloradans in lower income households were suffering disproportionately the brunt of job losses and wage reductions, and were objectively more likely in a worse place. But what's happened over the course of the last 2 years, as people are telling us they're concerned more about housing costs, they're concerned about the cost of fuel and gas, they're concerned about food prices. These are things that everybody, has to take money out of their wallets to pay for: middle income, upper income, and lower income. And so I think what we're seeing is all of the consequences that follow from that. People having to skip meals, people having to take all the steps that Lori described to try to cobble together the funding to stay in their housing. And so those impacts have just become much more widely shared among Coloradans than was the case in prior years. And so all of that, I think, is contributing to that greater sense of unease about their financial well-being.
Thanks for that, Dave. And folks, keep questions coming in the chat if you have more. We may need to phone a friend. I know we have a number of members from the research team on with us who are probably not looking at the PowerPoint, but looking at some of our other data documents. But somebody's sort of curious about the intersectional analysis, and I think it's such a great question. What about folks who are both people of color and people living on low income? What can we say about those folks who are essentially experiencing multiple barriers to achieving good health, and when we look at their specifically the support for policies and solutions, is there anything to be gathered there? Any differences when you look at both the sort of intersectional, the layers of identity there?
That's an excellent question, and we should have the ability in our data set to do a bunch of analysis of those intersections of different backgrounds and experiences. I haven't taken a look at some of those key questions among those subgroups, but I certainly would expect, just given what we're seeing when we see these differences by income and by ethnicity, that folks who are at the intersection of some of those subgroups that are expressing the greatest impact and the greatest concern, it'll be even more heightened. So that's one of the wonderful things we can do with this data set, is really mine that a bit. And that's an excellent suggestion of something we can take a closer look at.
Thank you. So before we look at some folks had questions about solutions, I'm interested in the renter piece that you were talking about, Lori. We had a number of renters. We saw not just support for the policy, but also the impact, the sacrifices that folks are making. Do we have any sense of, were renters more from Denver Metro versus other parts of the state? Anything you can tell us that help us understand this sort of group of renters?
Yeah, so renters tended to be somewhat lower income, but we saw renters throughout the state. We also saw that, renters are somewhat younger, not surprisingly. So, but not exclusively so. So, there's definitely some distinctions there. I mean, honestly, Jace, what this survey reminded me of, and especially what we saw in response to some of these questions was I did surveys in Russia in the late 90s when inflation was through the roof there, and we were trying to measure essentially coping strategies. And that's essentially what we're seeing again here, is we are seeing people try to figure out, how do I cobble together a number of different strategies in order to be able to make my rent and to pay my mortgage every month. And that sort of concern about the future and how we're going to pay for things is really striking. And it's something that it's not just limited to renters, right? It's not just limited to these lower income. The real difference, and I think one of the real takeaways for me from this poll, is how that is stretched into these middle income. And again, even some of those higher income categories, that these concern levels that were almost exclusively among lower income categories, as Dave talked about the past few years, has really been a dramatic and distinct shift. And you think about some of the communities that are struggling with housing costs now, some of those are, mountain resort communities and other places where we often didn't think of those as places where people are quote unquote struggling. So I think what we're seeing is a real bleeding throughout this data of many of these concerns into areas throughout the state and groups that had previously been somewhat less affected.
Thank you, Lori. I appreciate that. Robert in the chat is a man after my own heart. He's asking, how did we develop the questions? I love when people want to know the how. It's a painful part of the process because it means a lot of cuts. We have so many good ideas. And in fact, we got a lot of good ideas from external folks this go round. If you've been on our mailing list for a while, in January, you got an email where we asked, tell us what we should ask on the poll. And a whole bunch of people said housing and cost of living and mental health. So we devoted a lot of real estate on the poll to that. We're only talking today about cost of living and housing, but in a couple of weeks, we'll be looking at mental health, healthcare access, drug and alcohol use. So there's more to the survey than just the questions that you can see so far. But so we got input from folks in our world and from advocates who are trying to make good change in the world, trying to advance policy and health equity in their work. And then we had a draft that was too long. Of course we did. And so then we cut and we cut and we cut and we cut some more. And every time we asked Dave and Lori if we were done, they said, no, you need to cut more. And so it's a process. And we finally got to where we ended up. We landed at 46 questions. And a decent chunk of those, to Robert's other question, are some of the demographic questions. So Dave or Lori, would one of you do a quick overview of the other demographic data that's collected so folks know what's available?
Yes, and I actually just responded in the chat to that question. So we've got a whole range of demographics, most of which we didn't have room to show you today, but all of which you can access on the website. And for any of the questions in the poll, explore them in great detail. So we asked about age, gender identity, race and ethnicity, parent status, educational attainment, income, household size, employment status, voter registration and party, whether people spoke languages other than English at home, sexual orientation, and then country of birth. And we actually had even some more detailed breakdowns of race and ethnicity among Coloradans of color. So there's a wealth of data here where we can slice and dice all these questions by a number of different demographics.
Wonderful, wonderful. Thank you, Dave. So I was just looking back at the questions that came in. Nancy was one of our early question askers, asking us about solutions. You then saw that we tested some solutions, and there was quite a bit of support for some of these policy solutions. Certainly, you could enact all of those policy solutions today, and we might still have challenges. Just interested in hearing from Dave and Lori, as you think about what folks should do next. We've got advocates on the phone, community-based organizations who are looking at this data and thinking, what does this mean for me? What does this mean for my work? And would love to just hear how you think this data helps or hurts as we're trying to make good change in the world.
Gosh, that's a great question, Chase. So I certainly recognize that all of these are multi-pronged in terms of the approach, and it probably won't be one quick solution. But we are seeing, people, how should I say this, sort of demanding that their local government, that county government, that folks pay attention to these concerns and try and address them. And that's, I think, what we're sort of seeing in terms of the intensity of all the responses that we gathered here is really just sort of a cry for, hey, these are really important and we need to do something. So, which one of these I can't say, because obviously all of these have ramifications on lots of people, and could be thorny in terms of how you might get any of these enacted. But I think overall what it's saying is that particularly with the cost of housing, that we're seeing people really want to try some innovation and some new solutions. And I think that that's something that is being voiced quite adamantly.
Yeah, something that stuck out to me is particularly in those housing policies, is that Coloradans don't think that it's just one entity's problem to solve. There was support for landlords to do their part in lowering costs, for developers to do their part in lowering costs, and for the government to do their part in lowering costs. So I think there's sort of a recognition, perhaps, that there are market forces at play, and we need to look at all different kinds of levers to pull at this problem, because one policy probably won't solve all of the nuances. Okay, let's see. Let me check my list of questions. I see one that just came in the last couple of minutes about COVID-19. Did we happen to ask anything about stimulus checks, or were they mentioned and open-ended answers? So I will say we asked just a couple of questions about COVID. We're releasing them in the next phase, the week of June 6th, but we didn't ask about stimulus checks specifically. And I don't know if Dave or Lori, you have a memory of if stimulus was brought up in open ends at all? I don't remember it being a theme.
Yeah, I don't recall seeing anyone specifically mention it. I think it is a potential inference from the data that, some of the aid that was extended to Coloradans who were struggling during the pandemic may have helped to result in some of those numbers where we saw many Coloradans feeling like their financial situation had been maintained during that period of time. And it is possible that in addition to inflation and obvious increases in the cost of living, that the fact that some of those sources of aid are not available right now may be contributing to the increased economic anxiety. People feeling like they're not as well off and feeling like they're being forced to make these difficult decisions related to their food and housing. But there's nothing in the data where you can draw a real specific correlation and say that that's quantify how big a factor that is.
So you've heard me mention the next phase a couple of times. So I want to tell you what that means, Dave, if you'll go to the next slide. This is also your last warning. If you have other questions, better ask them now. But here's the plan. This year for Pulse, we are releasing the results in 3 phases. You are here right now with Coloradans on cost of living and housing. You can dig in much, much deeper. So on the Colorado Pulse poll website that's been linked in the chat several times, you can look at the slide deck and you can look at the crosstabs to see what demographic groups answered X or Y, what stands out in the data to you. You can dig deeper on your own. In 2 weeks, we will release phase 2, which will focus on health and well-being. We heard from a lot of folks when we asked for ideas of what we should ask. Mental health was very, very high on the list, so we devoted a fair bit of time to mental health. We also explored healthcare access and drug and alcohol use. We're releasing all of that data in just a couple of weeks. We'll make the data available on June 7th, and we'll have another briefing like this on June 8th with lots of time for questions and discussions. That's one of the reasons why we took a phased approach this year, because in previous years, we released all the data at once and we always ran out of time to answer questions. So I'm really enjoying these conversations that we're getting to have for people who are thinking deeply about these issues. The final phase is everything, the whole ball of wax. We'll dive deep into all the critical issues. There'll be some new questions and some new looks at some of the questions we released in earlier phases. So at that point, everything will be available. And we're going to have 2 more briefings. We'll have a briefing in English and we will have a briefing in Spanish on the 22nd and the 23rd. Check the chat for a link to how you can register to these briefings. If you are not registered, we would love to have you for these conversations. If you can't join us for briefings, no worries. Everything goes up on the website. And then as part of the 3rd phase, we will have an interactive data dashboard that allows you to dig deep into different groups by region, by race and ethnicity, by age, all different kind of demographic factors so that you can dig deep without having to stare at an Excel spreadsheet, which I hope is as welcome to you as it is to me. I haven't seen anything pop up in the chat as for any other questions. So I am going to call this a pretty well done briefing. I just want to thank you again for spending some time with us this morning, for digging into this data. We really appreciate the chance to share it and hopefully to make it usable for you. We don't do it because we think it's interesting, though we do happen to think it's interesting, particularly the nerds among us like myself, but we really want data like this to be used for good policy making, for good advocacy, for making good change in the communities where we all call home. If you have questions, get to me and I'll get you to smarter people than me. That's my primary job. So come to me and I will connect you and get your questions answered if you have more of it. But thanks everyone for being with us. Join us for our future briefings and take good care.